It's like this, right? This is my left portion of my pelvis, right? The way you can remember that, you don't need to remember it for the exam, but the way you can remember that is your acetabulum is where your femur head is going to sit, so you need it to be on the lateral side, facing the lateral side, and then your pubis needs to be facing upwards and inwards, right? So that's how you know. You can't sit like that, because then that's just backwards. My legs would be walking backwards. It has to sit like that, right? So, moving on. This area is your ilium, right? Within your ilium, you have your iliac crest, and then your sacroiliac joint is on the back. The way you can remember that is if you look on a big model, sacroiliac is in the name, so sacrum, iliac. So the sacroiliac joint is going to be there, right? Sacroiliac joint. Then you come a little lower, and that's your greater sciatic notch. Your sciatic nerve runs through there, right? Greater sciatic notch. Then you come kind of forward and down, and this is your ischium. This area is your ischium. You're going to have your ischial tuberosity. You're going to have your ischial spine. Your pubis is this area specifically, so there's your spine, and then ischium, or your pubis is that specific area, right?
Then that is your...
And then you're going to have your obturator foramen, and then your acetabulum,
See what I'm saying?
right? Your acetabulum,
If it is medium, this is your...
this isn't the right one, these do not match, right?
Medium malleus.
That's
This
how
media is your left.
your hip is, right? That's where the femoral head sits. You do need to know, I believe, how to identify if it's the right or left femur. So we'll do that real quick. So this is your femur bone, biggest, longest, biggest bone in your body, right?
Where it articulates with the...
You can know that this is your right femur based off of two locations I like to do. At least how I have it memorized. Your head needs to be facing medially, and then this groove needs to be facing posterior. Does that make sense? So this has to be facing there, this has to be facing back. So in order for that to happen, like that, because if we wanted it on this side, then that groove would be facing forward and that'd be incorrect. Alright, so on the femur, yes, correct. On the femur you should know your head, right?
Yeah, that's
Yeah,
what I'm saying.
head of the femur, yep. It's the ball of the ball and socket joint, right? And then your neck, right? Just the base of the head. And you come around. You have your lesser trochanter, your greater trochanter. Alrighty. And then if you think about it, got that, right? So gluteal tuberosity. Remember how we had that deltoid tuberosity up on the arm, and it was kind of that rough on the outside? Well, where is the gluteus, right? It's on the posterior side, so you know that it's going to be on that posterior side. So it's going to be that rough patch, right? It's gluteal tuberosity.
To be medial, right?
That's where it's all going to kind of connect onto the back of that femur. Alrighty? Then, coming down from there, see how there's like a fine line?
And the malleus.
It's easier if you run like your finger along it. It's got like, it's specific. You see how it comes up into like a point? That's your linea aspera, right? It's a distinct line that goes down the back of your femur. So now,
Yeah.
you've got your condyles and epicondyles, right?
And if you look at this one,
If I remember correctly, got your condyles. So this is your head, which needs to face medially. So we know that this is your medial condyle.
it's the same thing.
We know that this is your lateral condyle. And then you come outside, we know that this is your medial epicondyle, and this is your lateral epicondyle.
So here, right?
Nice
I
to
mean,
meet
the
you.
tuberosity,
We all know what the patella is. You can point that out if I pointed to a skeletal system. Point out the skeleton, the patella. But coming down here, because I don't have a good tibia or fibula to show you, I'm
so
showing
I
you this
can
guy.
say this tuberosity is medial right now.
Bring this
That's
up
the
here.
tuberosity.
So there's your
This is
patella.
the condyles.
By the way, it's not winched in like that. It's between two tendons, right? So I'll show you that on the joints when we
So
do
that's
that.
anterior. That's medial.
So your tibia
So this one
is this big piece. It's your shin bone, right? It's what why you wore shin guards playing soccer as a kid.
It hurts like hell when you hit that.
Hold the other one up.
You have your lateral and medial condyles,
That's it.
which
It's two different things.
How are you telling?
Because this the anterior and that's the medial.
so lateral condyle,
That's the anterior.
medial condyle, right?
What's the opposite?
Hmm?
Opposite. Medial, lateral.
Oh, yeah, I forgot I'm holding up the right leg. Lateral condyle, medial condyle, right? Your tibial tuberosity is right there. You can feel that on your own tibia, right? It's where the patellar tendon is going to connect on that tibia, right? And then, just nice and simple, remember how we had the linea spera on the femur? You're going to have the anterior crest, that line on the front of the tibia, okay? And then your fibula, all you need to know is that you have the lateral malleolus and then the head of the fibula. And then it's the same rules as the hands down here. You have your tarsals, which are these, the tiny bones, or the short bones in here. Then you have your metatarsals, which is 1, 2, 3, 4, 5. And then you have your phalanges, right, which is proximal distal, and then proximal middle distal for the other 4. Okay? So the way you can tell the tibia, because that's the other one you need to know, left or right, the way you can tell the tibia is you see how this malleolus comes a little bit further down than that side. You need to know that that is medial, and that this is anterior. That tibial tuberosity is on that front side always. Okay? So using that, you know to line it up. If this is on the outside and this is facing forward, then you know that this is going to be on that right leg. Okay? Okay?